broad issues, really. I mean, when we're talking about how to protect pensions in the time of turmoil, if we're talking about systemic risks, they are not diversifiable, so they are serious issues, then will have an impact on everybody everywhere in those situations. But then, as Jan Willem already in his opening words in the morning said, that we have also big societal issues as a consequence of different crises in the different turmoils. If people lose trust in society, then it has serious consequences. Also, Hans-Jörg Müller in his panel input talked about the fact that in their surveys they've discovered that younger people are driven with fear. And if you're driven with fear, you really do not trust long-term investments. You are afraid that something will happen, and you need the basic trust for the long term, for the society, for yourself, and to be able to trust the future so that you can save for your retirement as part of this. So from this perspective, we wanted to bring in a bit different point of view, so beyond economics, the health and social costs of the recent crisis. And for this, we have as a speaker Dr. Ledia Lazeri, who's the regional advisor for mental health from the World Health Organization based in Denmark. Unfortunately, she could not join us here in Berlin, but she will share her views on this issue via an online presentation. So if we can have that, please.
Good afternoon and greetings from Bratislava, Slovakia, where together with WHO colleagues, representatives of governments from countries that are receiving Ukrainian refugees, members of the Ukrainian refugee communities in those countries, as well as members of health professional communities, we are together to discuss on lessons learned, as well as to share good practices about how those countries have addressed health and care needs for the Ukrainian refugees that fled their country to safety in the neighboring countries and beyond since the start of the war in Ukraine. This is the reason why I cannot be with you today in person, but I'm grateful to the organizers for having extended this invitation to me and to WHO through me for reasons that I hope to be able to share with you during this speech. I am the regional advisor for mental health, and I lead a team in WHO Europe, and I lead a team of mental health professionals from a multidisciplinary perspective that is tasked with assisting our member states in moving ahead mental health agendas in their countries, be those development of mental health policies and monitoring and evaluation of those policies, including, for instance, mental health legislation, but also design of mental health services, but also a capacity building for the mental health workforce, promotion and prevention of mental ill health, anti-stigma and advocacy message and campaigns, development, and so on and so forth. It should have been business as usual if the series of the crises that we are facing in the European region hadn't hit. To start with the COVID-19 pandemic, it was very clear from the very beginning that the need for mental health care suddenly expanded. And we were very closely monitoring the evidence that told us in a year since the beginning of the pandemic, after a year, we understood that there were a number of groups that were particularly vulnerable in their mental health vis-a-vis the COVID-19 pandemic happening. And those groups were predictably children, adolescents, and young people, especially children, adolescents, because of the disruption in the routine educational opportunities and the disruption into the social exposure that they need to be able to thrive, to grow, to develop skills for resilience building. Another group that was found to be particularly vulnerable were the older citizens among us, who, because of the pandemic and the measures associated with that, found themselves to be lonely and isolated. So their mental health deteriorated at the height of the pandemic. We also found that we had a new group that we never before thought would be vulnerable, and that was healthcare professionals. I would like to recall your attention to what we all did. I certainly did, and I'm sure that there are those of you in the audience that also did that. We went to the streets, to our balconies, to applaud the health workers in sign of appreciation and of acknowledgement of the challenges that they were personally facing into caring for COVID-19 patients under overwhelming strain. Let us remember they lacked personal protective equipment at the beginning, and they are working in such uncertain territories that we all hail them and acknowledge the heroism in many of them. That changed. And at the end of the pandemic, the hostility against health and care workers grew to a point when some of our member states in European region acknowledge that they are developing prevention strategies against violence on healthcare workers. And that is only a symptom on how trust to institutions from the public has eroded. COVID-19 was only one um, event or one happening that contributed to the realization that the um, stability that we in Europe have taken for granted in the last several decades is precarious. The war in Ukraine caused devastation in Ukraine and continues to cause devastation in Ukraine, but is also causing devastation in the millions that have fled their country to safety in the neighboring countries and beyond. They have lost homes, they have lost livelihoods, they have an uncertain future, so it depends very much on how the receiving countries would respond to their needs for giving them a future. And luckily, Europe has shown solidarity in those times of strain for the citizens of Ukraine. And luckily, what we are hearing today in Bratislava, for instance, is how member states, how the governments of those member states that are receiving refugees have quickly developed strategies to be able to respond to those needs, to those sudden needs. But this has a cost. This has a financial cost because it means that those countries need to invest into those unexpected needs, and it means that the systems will have to change in order to respond to those unexpected needs. And the last event in the series of permacrisis is the devastation caused by the earthquake in Turkey and northern Syria, where we saw not only entire cities under the rubbles, but we also saw institutions suddenly disappearing from one day to the other. We have cities where hospitals are under the rubbles, where there are no healthcare workers because they either lost their lives or lost their loved ones or fled those cities to the safety of other cities in Turkey. So we simply do not have care workers to offer provision and support for the people in need, and then we have to rely on volunteers and on external aid, no, until the systems are back standing on their 2 feet. So again, it's a series of crises that remind us that the new normal, whenever this will be, will not be like the old normal. And then we have to be innovative, creative, and open-minded into restoring the systems as we want them, as we aim them to function, as we expect them to deliver. Uh, that brings me to how are we working in WHO Europe to address to address well-being from the mental health entry point. We have established this pan-European mental health coalition that is a convening body of about 300 stakeholders from all over the 53 member states of WHO Europe that represent people and parties who have an interest, who have a voice, who have expertise, experience, resources, and power to contribute to advancing mental health agenda in their countries and larger in Europe. We are honored to have those 300 stakeholders. Those are individuals, people with lived experience, individual professionals, but also big organizations at the European level, such as, for instance, Mental Health Europe, such as European Psychiatric Association, or Horatio, the Psychiatric Nurses Association in Europe, but also smaller organizations at the national level, such as, for instance, I'm mentioning the one important organization in the country where I am now, the Slovak League for Mental Health, and there are such organizations in many of our member states. So the coalition has representatives also not only from the health sector, but also from education, employment, social welfare, finance, and so on and so forth, in recognition to the fact that in order to improve mental health and well-being of this region, we need to rely on partners beyond the mental health and health sector. It cannot be the responsibility for improving mental health cannot be only on the health sector. And this is why I'm particularly happy that the organizers of this conference today extended this invitation to me, because you would be one of those organizations that through mutual collaboration can contribute to restore trust and to improve well-being for the citizens of this region. So going back to the Mental Health Coalition, we have a number of priorities that were set up in consultation with all the members of the coalition, and those priorities typically include mental health and well-being of children, adolescents, and young people, mental health and well-being of older citizens, but also topics like mental health at the workplace, which I hope is of interest to you, a transformation of mental health services, mental health leadership, and very importantly, integration of mental health into emergency preparedness, response, and recovery. Now, I could go on for hours sharing with you more information about those priorities that we are addressing in WHO Europe, but I'll stop in one or two points that I hope are of most interest to you. I'd like to talk about mental health in the workplace, because this is important not only because probably this is of most interest to you, but also because we have a paradigm shift in WHO Europe when it comes to mental health in the workplace. When we were talking among the global health communities, let's say a decade or two ago, about workplace mental health, we were mostly referring to the opportunity that workplaces gave to people with severe mental health conditions into integrating into social life, into gainful employment. So we were looking in the workplace as a limited opportunity for a limited number of people, namely those who are living with severe and enduring mental health conditions, such as, for instance, schizophrenia or bipolar disorders. But then evidence shows that workplace can both play a protective role into our mental health and well-being, but it can also play destructive role in our mental health and well-being if there are no protective policies in place. And because all of us spend 1/3 of our life when we are in working a period in our life, we spend 1/3 of our life is spent at the workplace, which is why WHO and the International Labour Organization came to the development of the guidelines for mental health at the workplace that were announced and published, made available for the public in September last year. The workplace start with a recognition why mental health at the workplace is important, and then goes on with recommendations how can all stakeholders in the workplace, including employees, how they can contribute to better mental health and well-being at the workplace. Right now, we at WHO Europe are conducting a research about good practices on policies and provisions about mental health at the workplace, and that the results of that exercise will be made part of a final report that we are developing about a snapshot on what is happening in mental health in Europe on all the themes of the Pan-European Mental Health Coalition, workplace mental health included. So, by going to workplace mental health, by talking about workplace mental health, I'd also like to mention how important it is that to maintain safe and healthy climate in the workplace, we have a possibility to protect also the future of the current workers. And we have the possibility to protect the pension funds. More people are engaged into healthy and safe relationships with their workplace, safer their future is in terms of their mental health and well-being, but also in financial terms. So it is a responsibility we have today, we, the people in the working age, it is a responsibility we have to protect our pension funds for the future, to protect the pension funds of those who are retired today, but also to protect the pension funds of those, or the pension opportunities of those that are entering now the job market. And that cannot be done without restoring the trust in the institutions, without restoring a mutual collaboration between citizens and institutions. And that brings me to what we have found in the Pan-European Mental Health Coalition, especially in the dedicated evidence monitoring that we had during COVID-19 pandemic, because we found these niches of particular vulnerability, such as young people, old people, health professionals, but also persons with living with mental health conditions. We have a task to address those both with our member states, so the governments we work with, but also with our networks, mental health networks. And in that sense, for instance, one of the approaches we have is how to make our communities, how to empower our communities so that they offer safety for our most vulnerable citizens. And we have in WHO Europe this network that is called Healthy Cities Network. And part of the Healthy Cities Network is to see how can local governments contribute to making things better for old and for young. Are our cities walkable? Are our cities urbanized sufficiently so that our weaker citizens can enjoy full opportunities that a city can offer? Are our cities complying with disability requirements, for instance? Or our cities, are they friendly for older citizens? Do we have sufficient parks for children to socialize? And also, are our cities smart in terms of digital life? No, because one of the discussions we are having, for instance, in WHO Europe, and what we hear from young people is, oh, you grown-ups, and I'm quoting a young person living with multiple disabilities that she attended one of our meetings, and she said, you grown-ups talk about digital means as being necessarily a bad thing. But for a person like me, she said, being able to operate and to access care through digital means is actually a very safe option, she said. So I'm actually enjoying the opportunity to access care and to socialize through digital means. And we need to be open-minded about that. We need to reorient and to reprogram and to revisit the way how we think about institutions in an innovative way, taking stocks of lessons learned from this perma-crisis, taking stock of opportunities that were raised during this perma-crisis, such as, for instance, never before mental health professionals had accepted, to the extent that they accept today, the delivery of mental health care through digital means. And this is an opportunity that we need to take advantage of, and we need to be able to offer and to make it accessible for even those communities that do not have digital literacy. So you see, being able to use innovation to our advantage. And last, before I close, and with many thanks for your attention, is there is no crisis that does not produce an opportunity. And as we have found out, no mental health advocacy campaign has been as successful as COVID-19. Never before we had so much attention from member states, from organizations like yourselves, from individuals, from health professionals, to the extent we have today about the importance of mental health and well-being. So we are trying to take stock of that. We are trying to use that momentum because we understand that this is a critical momentum that, if we are not using well, will be a wasted opportunity. And in this sense, I am very thankful that the organizers of this event recognize the importance of mental health and well-being to the point of extending this invitation. And I'm very happy and very open to be working with your organization in the or in the realm of the Pan-European Mental Health Coalition, where I hope you will be able to also find interesting partners that can contribute to your mission, but also bring your mission for other interesting partners that might be able and willing to embrace it. With this, again, thank you so very much for this invitation and a very good follow-up of the event. Thank you.
Thank you very much, Dr. Lazeri, for these serious and sobering thoughts, and good to hear that there's attention and actions as well on this issue. It is really important for pensions, mental health issues. For example, if I take my own country, Finland, as an example, 1/3 of the disability pensions are because of mental health reasons, and this is mainly younger people that are then disabled to work the rest of their lives. So it is a huge cost for the society, but also at human individual level. So important issues.